As COVID cases rise locally, Wake County is bringing you more chances for speedy testing. Thanks for joining us tonight. I'm Chris Lovingood.
And I'm Michelle McConaughey. Drive-thru testing has returned to Cary, but it's a little different as other respiratory viruses are also spiking. Now, one swab will also test you for the flu.
WREL's Liz McLaughlin joins us live from Cary, where testing just wrapped up for the day. Liz, I'm sure quite a few people came out there.
That's right. A steady stream of folks. It's quiet now, all wrapped up for the day, but there will be 2 more clinics in the new year as cases of both the flu and COVID are expected to rise.
A steady stream of cars filed through a free COVID and flu testing site in Cary today.
Incredible. It's very important because it's allowing people to get tested who wouldn't even think of it before.
After pre-registering online, I went through the testing process myself. It took less than 5 minutes, with results in 24 hours.
COVID and flu testing as well. We use that one swab and basically take both samples for the testing.
Nationally, COVID and flu cases are on the rise, and experts expect those numbers to surge post-holiday.
So we knew we were going to have a bad flu year, and we're having a bad flu year. On top of that, the embers of the COVID pandemic have flared up again.
While community spread here is low to medium, according to the CDC, 56 patients are currently hospitalized for COVID-19 at Wake Med. Seniors are taking the hardest hit, with waning immunity contributing to a spike in hospitalizations and deaths in the state.
If you are 65 plus and have not gotten the bivalent vaccine, you're asking for trouble. They're just the people I'm seeing in the hospital now, right here today in the hospital, who are very sick, are older and under-vaccinated.
A reminder to stay safe as deadly viruses spread.
Those vaccinations, of course, so important to preventing illness. But if you are experiencing symptoms, it can be really valuable to get tested. If you know it's the COVID, if you know it's the flu, if you know it's RSV, then that can give you access to different medications. The flu, for instance, you could get Tamiflu, which can shorten that recovery time, help you get back to work or school sooner, and also prevent hospitalization. Live in Cary, I'm Liz McLaughlin. Back to you guys in the studio.
With all the celebrations happening, this is very timely. Thank you, Liz.
And as we head into the new year, there are new concerns about COVID-19. Starting January 5th, the U.S. will require a negative COVID test from travelers coming from China. This comes as COVID patients fill up China's emergency rooms. World leaders say they are concerned about the lack of transparency in COVID-related data from China. And we're also learning that COVID-19 is on the rise in Japan. Japanese officials reported a record 420 COVID deaths for yesterday. That figure makes it the second consecutive day the country reached a record number of deaths from the virus. The health ministry also announced that the country has entered an epidemic of the seasonal flu.